You're listening to The Back 40, the podcast for Ontario farmers, covering topics and issues that matter most to Ontario agriculture. Brought to you by Trillium Mutual Insurance, bringing the ag community together one podcast at a time. I'm the host of The Back 40, Mike Bryan, agribusiness specialist at Trillium Mutual Insurance. When people think about the University of Guelph, they often think about the Ontario Agricultural College or the Ontario Veterinary College. My wife has a degree there from the Family and Consumer Studies from a few years ago, and I myself have a Bachelor of Science in Agriculture. And those are all things that people would associate with the University of Guelph. Part of the university that is not as well known is the One Health Institute. It's relatively new. This morning, we're going to be talking to two professors from the Ontario Veterinary College who are very much a part of the One Health Institute. I'd like to welcome Dr. Jeff Wichtel, the Dean of the Ontario Veterinary College, and Dr. Cate Dewey, the Associate Vice President of Academic for the University of Guelph. Cate and Jeff, welcome to the Back 40.
Thank you.
Thank you, Mike. It's a pleasure to be here.
So I'm going to start right at the beginning here. What is the One Health Institute?
Well, I'll take a step back, Mike, and say, as you correctly pointed out, the University of Guelph has certainly been known and certainly branded itself over the years as a food university, touching on its agricultural roots. But increasingly, we've realized that we have tremendous bench strength in health as well. And in fact, most of the things that we work on affect health of animals, humans, and our environment. And that's really what One Health is. It's a concept or an approach that really acknowledges the interconnectedness of the health of people, animals, and the environment. And the One Health Institute was established just 3 years ago, really acknowledging that the University of Guelph has a role in protecting and enhancing the health of people, animals, and the environment, really our planetary health, and that we are going to commit to this as a strategic pillar for the university for the next number of years to really advance this idea, both on a research perspective, but also in our academic programming to try and prepare the next generation of leaders, thought leaders, in this idea of complex thinking about the interconnectedness of people, animals, and the environment.
So this concept, it's been around for a long time. Certainly from an agricultural standpoint, we reach into multidisciplines in order to solve some of our problems on the farm. What's the concept behind this, though? Can you kind of put that all into a little bit of an explanation of how this all fits together?
If we think about working with a veterinarian or working with a soil scientist, we often think about working in our own silo. So how do I, as a veterinarian, solve a problem on a farm? What we recognize is this complex interdisciplinary nature of the problems that we encounter. And if we can think specifically about farming and farmers and what they live in a day-to-day manner, we think about the impact of the environment on what the farmer does, the impact of the health of the animals, and of course, that concept that farmers feed the world. And so it's the understanding that if we don't take care of the questions involving the environment, and the environment includes the built environment, so the structure of the barn, if you will, if we don't take care of the soils, if we don't plant and harvest around the weather, we could actually have a huge impact on the farm. From an animal health perspective, we know the impact of devastating disease on the farmer and those that work in the barn versus somebody working with healthy animals. If we step back and say, well, there's a problem on the farm, how are we going to solve this? We don't tend to have only one person coming in. We will be bringing in a team of people to solve a problem. So I think we've been doing that on the farm for a long time, but we haven't necessarily done that as a society to bring people together across disciplines to try to solve complex problems. And what we're maybe realizing a little bit late is the impact of social scientists in trying to solve health problems. What we're getting at there is, how do we change human behavior? How do we get people to change what it is they're doing to make themselves healthier or the animals and the environment healthier? how do we understand not only how these disciplines work together to solve complex problems, but how do we build teams and how do we enable people to think across disciplines? So we use this term transdisciplinarity. And what we mean by that is, as a veterinary epidemiologist, I know how to do my own discipline, but if I bring in an anthropologist and understand gender differences and understand how to do research work, including the gender lens or the social determinants of health like poverty or lack of education, then I can do a more fulsome project and maybe really get down to the roots of what the problem is. And the other piece of that we often haven't done in our research work trying to solve problems is bringing in the community. So how many times have we sat around a table with a group of farmers saying, we want to solve this problem on the farm, but can you tell us what you see as the problem and what kind of solutions you might want us to direct our research towards? And start with what the community says, and then from there build out our research projects. I think as One Health practitioners, we're understanding the role of community and what we're doing to solve problems more than we did in the past.
Is part of the problem here that we really haven't taken the time to properly define what the problems are in the industry and what the problems are when we see them? And I'm thinking back to an example of my own where I was a feed salesman and we had bloody scours in a barn combined with PRRS and just couldn't do anything about it. The guy looking after the barn says to me, I just hate going to the barn. I know there's going to be more dead pigs. I hate going to the barn. So that's something we never dealt with at that time. Is that the problem? We're not defining the problem correctly?
Oh, absolutely, Mike. And it's human nature, isn't it, to try and simplify things. And it's also human nature to try and go from what you perceive as the immediate problem to an immediate solution. But that's why problems keep recurring, is because we haven't looked at the more systemic issues that are at play. And that's what One Health, it's both its advantage, but also the problem, and that to put the right heads together to solve the more fundamental problem that leads to these issues is actually really hard work. The work takes longer to do, it's more costly, and it makes you have to go and reach out to people you don't normally talk to. Personally, I don't talk to a lot of philosophers or anthropologists or whatever, or social scientists or even clinical psychologists. But if I'm going to solve some of these fundamental problems, I think we've sort of alluded to mental health in rural communities. It's probably deteriorating over years. And, if we're going to solve those problems, we as veterinarians can't do it, even though we're the most frequent visitors to the farm. And, people in the mental health area cannot solve it either on their own. We've got to work on that together, right? And so these are difficult problems, and oftentimes they're connected to issues that are happening that are global in scope, like climate change, droughts and floods that we're seeing out in BC, like antimicrobial resistance or new disease issues such as you experienced when you were a feed salesman, that can devastate not just the business model, but people's feeling about what they do every day and really affect mental health. So these are complex problems. And you're right, we're often scared to admit that they are beyond us to solve in a fundamental sense and go out and seek help, seek other people to come in on the team and help try and solve these problems. We're all guilty of short-termism, right? Governments, they're guilty of just looking to the next election. And we as people, even in our own homes or businesses, are also just worrying about how you pay the next check. Are we going to have a good year this year or not? And we don't often have the energy to invest in this longer term thinking, but we have to. We absolutely have to. And I think most farmers realize that there's some serious issues coming down the pipe at us. We have to encourage all of ourselves, both personally and as organizations and institutions and as governments, to think longer term.
Is part of the problem there that you've talked about, that we do get kind of caught up in our own area of expertise, our own little world there. And as you say, we want to go and solve that one problem. Mm-hmm. If we go there, though, how wide do we go on these problems here? Who all would be involved or might need to be involved in solving some of these problems when we go to a multidisciplinary approach?
Problem specific, right? So if, for instance, we're talking about environmental degradation and climate change and how that might affect food security for Canadians and the business models for farmers and the likelihood that, food is going to be in the supermarket and on our table, we kind of know who needs to come in on that discussion. They're not always the people that we talk to every day, right? But we do need to acknowledge that people's attitudes to agriculture and stewardship of the land is changing. And, we need, as Cate said, to really engage with the community, all the stakeholders. It's hard to do, it's expensive, and it's a long-term project. But if we don't do it, then we're probably going to make the wrong decisions in the short term in terms of preparing ourselves for the future and protecting Canadians and making sure there's food on the table for us in the future. Yeah, but I do think, and certainly Cate and I are quite engaged in the idea of trying to change the vocabulary around health to really include these other players so that our work, when we're speaking to government organizations that fund our research, for instance, really understand that these more complex problems are going to take a little extra work to solve.
The One Health Institute's been around for 3 years. I saw a quote from Charlotte Yates, who's the president and vice chancellor of the University of Guelph. It's the One Health concept is fundamental to the University of Guelph. It's embedded in everything that we do, teaching, research, and outreach. This is something that the University of Guelph has been involved in for many, many years. Why all of a sudden formalize it?
You're right. We've been doing One Health for, I'm going to say forever. If we think about the university reaching out to do extension work, to work with farmers, both the agriculture people as well as the veterinary scientists, of course, we've been doing that for a long time. And we have maybe thought quite holistically, both as veterinarians and agricultural specialists. As an example, I remember solving a farm problem by bringing in an agricultural engineer. I knew, it was beyond me to solve. But what we haven't done is we haven't thought as broadly as we might with respect to bringing in the social scientists as we've been discussing. What we are recognizing at the university is that many researchers at the university are doing research at the periphery of One Health. And here's an example. There's a philosopher who works on the vaccine hesitancy. And so this is related to the COVID-19 pandemic that we're in. So we understand it's a virus, the COVID-19 is a virus. We understand that if we're vaccinated, then we can be protected ourselves and our communities can be protected. What we didn't necessarily bring into the picture with respect to this problem is vaccine hesitancy, how we understand that and how we change behavior. What we're doing at the One Health Institute is we've reached out across the university and asked faculty if they were doing One Health research or teaching in One Health. Pretty well overnight, we had 150 faculty members who became affiliated faculty members with the One Health Institute because they were working on an aspect of One Health. And so what we are trying to do at the One Health Institute is saying, well, this is what you're working on, and maybe you're a soil scientist, and this is what I'm working on, and I'm a veterinarian, and this is what somebody else is working on, and they're maybe looking at implications for farm families from a social scientist point of view. Let's team up. Let's join forces and look at these complex problems and start to work together in a way that we've not ever done before. So that's one aspect of the One Health Institute, is how do we bring people together from multiple disciplines who are actually working on similar problems, but they didn't know about one another before, and build those teams. But the other really important part of the One Health Institute is training the workforce for tomorrow. How do we take students who are interested in One Health and how do we train them so that they understand policy and they understand health and they understand the impact of animals and climate and other environmental considerations? How do they think broadly, and then when they graduate, go into society to be ready to solve complex problems and bring teams together? We currently have a collaborative specialization for graduate students. Graduate students in any of 18 different disciplines can say, I'm doing a One Health research project. I'll become a collaborative specialist by adding One Health to my program, taking One Health courses, and these students in multiple disciplines begin working together while they're students. We have a new undergrad program that is coming on board in September. This is a 4-year program. It's going to have a co-op opportunity. So students will be going out into the field and working in One Health while they're in their undergrad program. But what's exciting about this program is we will be teaching students about One Health from first year, but they are going to be studying across disciplines. And then as they progress through their degree, they're going to specialize in policy or in social determinants of health. They're going to specialize in disease as we understand disease from a human and animal perspective, or they're going to specialize in environment. But these people are going to be naturally building transdisciplinary thinking all the way through their program. It is the most novel One Health program in North America. And what's exciting about it is now that we've been promoting it, we have people from around the world interested in this undergrad program. So from various parts of the world, they're reaching out to us and asking about the program and how can they enroll. About a month after we started the One Health Institute at the University of Guelph, the students on their own started a One Health student club. And within about 2 months, there were 200 students across the campus that were involved in this One Health student committee. And today we had 400 students. They are a very, very active group. Before we even had One Health programming on campus, students understood One Health and wanted to be part of it. I think the future is really exciting in One Health. I think that the youth of today, high school students and university students, understand and believe in One Health, and they're going to be carrying the flag, if you will, and wanting to work in One Health when they graduate.
I think we all get a little bit myopic. We get into a problem, then we just really start to focus down and we forget that there's other aspects to that. As far as the undergrad program goes, where do you see the career path lying for people that are going to graduate out of the undergrad program?
Well, I think you've hit on something, as Cate says, and it warms our heart greatly to see the youth of today understanding the complexity of the problems ahead of them, perhaps the complexity of the problems that we're leaving for them. I think we have perhaps a harder job convincing or at least educating the greater community around One Health. But we do survey our employers frequently about what they like and what I think we could improve on around our graduates. And when you look at the results of those surveys, the kind of skills that they're hoping to see more of in our students are things like critical thinking, leadership, confidence in working in teams and leading teams, writing skills, being able to reach out and collaborate across disciplines. If you listed competencies in the One Health undergraduate program, these are they, right? So I believe that this One Health program, not only is it innovative in that it's producing people who can think through complex issues and work in areas of uncertainty. And let's be honest, these problems often result in failure. So you have to be okay with failure and try again. Put a different team together. Bring someone in that you forgot to include last time. That's why people's behavior didn't change. It's because we didn't think about that. Maybe it's a cultural issue. Maybe it involves an indigenous community. Let's work with that community. These are the things that many of our employers are looking for in our grads. And I believe that this program will deliver it. And then I think the culture of that approach to educating young people will then leak out through all of our programs. One thing that I'm not sure if Cate mentioned is that it's intended to have a strong experiential learning component to this program. So we're really hoping that every student will get the opportunity to be in a workplace or in an institution, NGO, or an organization where teams of people are coming together to work on these complex problems so that they can actually put these skills into action before they graduate, and they're much more comfortable. And then oftentimes in their new place of employment, they'll be the change makers. That's how we see it.
It's something, though, that is kind of a work in progress, right? Because until you actually graduate some students, you're never really entirely sure where the program's going to go, where they're going to go. And I know I've talked to a lot of people that throughout COVID, where they thought that their business were going one direction and they ended up with a totally different customer. And this could be the exact same thing. Who you think you're educating them for might not end up being that person.
Quite right. It was always thought to be a high-risk venture, and that's why no other university has been brave enough to actually develop an undergraduate program purely based on One Health. We're not aware of another one in the world. But we're very gratified, as Cate pointed out, about the early response we've had to this, both from future employers, but certainly the young people that might join us in this program. So increasingly, we are less nervous and more excited about this prospect. And we've had a lot of positive commentary from other people in higher education saying, good for you for trying this. And I think what we have here at the University of Guelph is something that I don't think has existed, to my knowledge, in any other university that I'm aware of, which is an absolutely uniform support from for this idea, from the president down to the faculty, staff, and the students themselves. Everybody is behind this. Every college on this campus is involved. That's a difficult thing to do, but we seem to have achieved it. And I think that really augurs well for its success.
I think that one of the things that maybe drives me nuts more than anything else is when we start talking about various problems, such as food insecurity in areas, or the fact that food doesn't move around enough, or the environmental issues, and somebody says, there's a simple solution to that. And I've always said, when someone says there's a simple solution to that, you've obviously failed to understand what the question was in the first place. And this is a way of going about solving those problems and looking at them from all different directions so that you don't miss something. Do you like what you're hearing from the Back 40? We'd like to hear from you. Send us an email with your comments and thoughts to theback40@trilliummutual.com or follow us on social media @TrilliumMutual. One of the things that I was struck by when I had a look at how your advisory board is constructed, and I looked at the people that were there, and we have people that are epidemiologists, such as yourself, Cate, environmental scientists, food safety, integrative biology, even computer science. I get all of those. And then I looked at Andrew Bailey, who is from the Department of Philosophy, and Chris Inwood, who is from the Department of Economics and Finance. And I look and I think, okay, I get all those others, but those two don't really seem to fit in, at least not in our conventional way of thinking. Is this more about how we bring more people into this and solve some of the problems that we have not looked at before?
I think your audience, Mike, is going to understand fully why we need the economists at the table. When we're talking about solving problems, complex health problems, both human health, animal health, and environmental health, I guess all three of those, we do need to think about the economic impact of some of the policy changes we make, or even smaller. What's the economic impact of making a decision on a farm? Does what we're recommending as veterinarians make economic sense for the farmer? So, I think the economist is such an important part of it. I did a research project with smallholder pig farmers in East Africa. And when I was doing that project, what I recognized is the importance of the economists in the picture, because I needed to deal with butchermen, and if we're thinking about the whole cycle from growing the pig to butchering the pig to selling the pork, I think we need to include that economic piece. So it's very interesting that you point that one out, because to be honest, the people in the Lang Business School wasn't so sure how they fit in at the beginning either. And so it was very purposeful that we brought people from all the colleges in, because those of us who've thought about One Health for a long time saw very clearly how they fit. But when we were putting together the advisory committee, we asked for faculty members who would be willing to be on our board. And so we maybe haven't brought the economics into the research teams as much maybe as we thought we might, but I'm sure that that's going to happen. With respect to the College of Arts and Philosophy, it's been very interesting. We've actually had a lot of engagement from the College of Arts, people who are in history, who understand the role of animals in our society, people who are involved in philosophy, who maybe look at obesity in pets and in people. And then I guess the other thing I would say is the role of arts in understanding human behavior and changing human behavior. Although on the surface, when we're thinking about health, we don't necessarily think about the College of Arts, but actually they've been quite engaged. And similarly, the College of Social and Applied Human Sciences, which includes people in psychology and people in political science. Also, they've been very involved in our project. And one of the key people who's been hired in One Health is an anthropologist. And so understanding people and, again, their relationship with wildlife or their relationship with the animals that they choose to eat is an important part of One Health. Probably for those of us who've been thinking One Health for a long time, is expanding our own understanding of One Health and where One Health can possibly go. It's quite exciting.
One of the things that has taken the majority of our attention over the past 20, 21 months is COVID-19. And this seems to me to be one of those things that is an obvious place that the application of the One Health concept would fit in. Do you want to just comment exactly on how this all fits together using COVID as an example?
Sure. Human pandemics like COVID are a perfect example of maybe a failure to take a One Health approach. And it's not that people are not working in this area of emerging pandemic diseases and trying to apply One Health concepts to solve it or prevent them, but they are hampered by a more traditional approach to research and to policy. And I think we've seen the results of this. We all, I think, understand that almost all pandemics, over 70% of new emerging human diseases come from an animal population. And those animal populations are giving rise to these diseases sometimes because animals that are not normally in close contact with humans become in close contact, whether it be due to environmental degradation or increasing populations requiring humans to access food sources like wildlife that they have not had before, or because of cultural inclinations to use certain animals as food sources. So all of these things, this is a very, One Health problem. And even today, I think we're seeing the results of simplistic thinking. Of course, Canada has dealt and struggled with COVID and continues to do so today, just like every other country, and it's done its best. But when you look at, for instance, government's approaches in the next year or so, the federal government is investing heavily in vaccine development and manufacture and therapeutic development in Canada. Fair enough. These are incredibly important, and we should have vaccine manufacturing capability in Canada. But where's the investment in predicting and preventing the next pandemic? No one's really talking about that as to how we got in the situation where we had almost 2 million Canadians affected by COVID. So that's a One Health problem. It's a hard problem. It's not an easy headline, as it is to say we're developing vaccine manufacturing capability in Canada. But we do have to put teams together which can help us. And that kind of team will have sociologists, it will have economists, it will have all of this diverse group of individuals who can help us, because it's not just a Canadian problem, it's a global problem. Even today, the news is a new variant emerging in South Africa. It probably didn't start there, but that's where it's being detected. Why? Is because countries like ours and like those have not managed to roll out vaccines and protect their population quickly enough. Now we've had an opportunity for the virus to transmit in these populations. And of course, a new variant arises. Our epidemiologists and our fundamental researchers that look at these viruses predicted this would happen if we didn't get the whole global population vaccinated. And now it's likely look like it's going to happen. So these are big, complex One Health problems, and we need to encourage those who direct and incentivize research and outreach and community engagement to tackle these big One Health problems and invest in them.
Is part of the problem us? And we talk about government, but government is us, right? We elect our government to represent the people. But many times we have a really narrow attention point, right? Like we want to see that we've got vaccines being developed and being produced in this country, but we don't look at the whole problem, and we don't look because, you're talking about predicting the next one and everybody's like, well, hold on. We're just interested in this one, and how do we get out of it? And that's vaccines.
Oh,
Is that a lot of the problem here?
Oh, it is. Yeah, I think I mentioned before, it's just human behavior to engage in short-termism, as I called it. We're always worried about the next thing, and our horizons are quite short. Government is a reflection of us, and government works on the same cycle. And so that's why a lot of these very difficult problems are left and the can is kicked down the road for obvious reasons, because they're hard.
Yes. And when you talk politics, right, like at best, if we have a majority government, we've got a 4-year horizon for that. And as we have now as a minority, it might be significantly less than that. Nobody wants to tackle a problem that's going to be solved for 10 years down the road when their problem is to be elected in 2 years.
Right. We see it every day. I think we're all kind of anxious about, for instance, Cate and I obviously have had careers where we've engaged with, livestock and the families that raise livestock. We're all kind of anxious about where the livestock, the food animal industries are going in response to changing societal attitudes to food and welfare and environmental stewardship. And we really need to sort of change the conversation. Right now, the conversation has been dominated by animals equals bad for the environment, animals equals bad for health. And we have a whole different conversation that we could be having. But we as organizations, as farming and veterinary organizations and rural development organizations really need to get together and talk about a longer term strategy beyond just next year, beyond just incrementally increasing market share or trade or whatever, and really think on a 10 to 15 to 20-year horizon about what we're going to say about the importance of livestock and land stewardship and the culture of our society and the fantastic record we have here in Canada of safe food grown with welfare principles in mind and all these things. But unfortunately, in many cases, the conversation isn't ours. We're not driving it. We have to find a way of doing that. But it takes a longer term kind of horizon of planning to do that than just tomorrow or next year.
I think that's a problem that we've seen in take any problem that you're looking at, whether it's the environmental issues that we're facing or whether it's COVID. We've gotten into that problem because we don't think 20 years down the road. And you would think that would teach us something, but it never seems to. We never seem to learn because we forget. Our rear view mirror is pretty short too. It's only like a couple of years back. Both of you are quite heavily involved, both as professors at the University of Guelph in the Ontario Veterinary College, but you're also very heavily involved in the One Health Institute. Could you tell our listeners what exactly is your role in the One Health Institute?
I am currently the chair of the advisory board of the One Health Institute, so that's primarily my role. From the inception of the One Health Institute, we wanted to try and ensure that we didn't repeat past mistakes, which those mistakes in academic institutions has largely led to the One Health discussion being generated from the veterinary schools. I think because veterinarians are trained to be systems thinkers, they're trained across many species, many disciplines, many environments in which they work, and they're out in the community and the environment constantly. The One Health concept comes naturally to veterinarians, but not so much for human medical or public health people, maybe not so much for some of the other disciplines that we've talked about here today. So that's why we constructed the advisory board with this broad base of expertise and disciplines. So yes, I am currently the chair of the board, but I don't see, the dean of the Ontario Veterinary College really having a permanent sort of leadership role in this. We really want the leaders to emerge from a broader community.
Kate, what's your role within the One Health Institute?
I'm currently the director of the One Health Institute. And as director, as Jeff mentioned, that's not a long-term position. I will be replaced by somebody else down the road who has other creative ideas for the One Health Institute. But really my role in the One Health Institute right now, I guess I see this last 3 years has been building community. So making people across the university understand what One Health is and how they can become involved. Very definitely, Mike, this is a fabulous opportunity for us because it isn't also my role, I believe, to make sure the broader society knows that the University of Guelph is a center of excellence in One Health. And so I appreciate this opportunity to talk. We didn't have programs for graduate students and undergraduate students specifically in One Health. And so that's been a really big, important driving force for me. In May, we're going to have a symposium, a One Health symposium in May at the University of Guelph. 2/3 of it is virtual and one day will be face-to-face so that we can share more broadly with whomever is interested in coming to the conference, that what we do in One Health, but also invite people from outside the university to come and share what they're doing in One Health as well. So I really see this first 3 years was about building it and sharing more broadly what we're doing and continuing to build on that. And I think that the next step is to do what Jeff has been talking about, which is finding funding sources to have large research projects, multidisciplinary research projects to tackle the One Health problems that we see most imminent in our society today.
You know, it's funny, you just don't know why these things happen, but a lot of things have come together, obviously, to make what we've done at the university just very timely, right? You know, COVID being one of them. You know, there just seems to have been an outbreak of One Health thinking across the world in the last couple of years. It's sort of been there quietly, but now we've got deputy ministers and ADMs and people in WHO and other international organizations all sort of integrating One Health language into all of their announcements. The WHO and the OIE, which is the organization that takes care of animal diseases, and FAO, I think, is the other part of the tripartite. They've established One Health kind of working groups, international groups, and another one on antimicrobial resistance that is instructed to take a One Health approach. The US government has included One Health legislation in some of their bills lately. And we go, wow, where's all this come? We've been talking about One Health for 30 years and suddenly everybody else is talking about it. You know, what happened to me when I came here as dean was, you know, I'd been sort of quietly trying to work as Cate has on One Health for my entire career. And suddenly I've got the president and the vice president researcher breathing down my neck saying, why aren't you doing more One Health? It was just a real sea change all of a sudden. Cate and I were almost harassed about it. Do more yesterday. So it's funny how things change. Everything has its moment, right? And I think One Health is having a moment right now. We couldn't be more happy. We'd like to say that we sort of managed the timing of our programming at the University of Guelph for this. But honestly, the truth is it's a little bit of a coincidence or a coming together of global factors. People's frustration, for instance, in how little progress we're making on climate change or on fighting antimicrobial resistance, some of these bigger issues, concerns about how health issues in the global south are still, despite significant decades of investment and thought, are still major issues, some of which we're just not making enough progress on. The ineffectiveness of international aid, and even the poor effectiveness of solving health issues in our own country, like in the North and in Indigenous communities. There's just a high degree of frustration that we've been so unsuccessful in so many ways, and that there must be a different approach. And so One Health seems to be having its moment right now.
This goes back, it was a comment that was made in regards to animal welfare, particularly in hog barns and sow gestation crates. The person who was doing the talk says, we all think of progress as being linear, but it's really not. Mm-hmm. There'll be something that will kick it and all of a sudden it'll happen, as opposed to, well, gradually it seeps into our awareness. I think that's a lot of it here. The circumstances that you talk about, whether it's climate change or microbial resistance, certainly COVID, you simply can't solve those by looking at just one little bit of the puzzle. You've got to look at the whole problem or you'll never solve it.
Absolutely.
In our country, we think about health and we think about hospitals. And we think about funding hospitals, and I'm not taking away how valuable it is that we do have the healthcare system that we do have in our country. We're very lucky. But I think that we do need to put more money and more thought and more research into the concept of public health as opposed to, the emergent hospital needs. Because it took COVID for the public health experts to come to the forefront and, be on the radio every day. But the truth of the matter is they do really good work every day, year in and year out. We just don't fund them very well to help them to do the preventive medicine that we know is so important. And if we think about that with respect to the One Health concept, well, One Health concept is about, as Jeff said, preventing the next pandemic. It is about working in the preventive way as opposed to the immediate, oh my goodness, are the ICU beds full? And this is policy change. This is how do we shift governments into thinking more about putting money into prevention as opposed to acute care?
We've only just scratched the surface of both the concept and about what the One Health Institute is. If people want to find out more information about the One Health Institute, where do they go?
So we have a great website, I think. It is called One Health, all one word, onehealth.uoguelph.ca. If people don't remember that, if they put One Health Guelph into their search engine, they'll find it.
That's awesome. I want to thank both of you for joining us today. This is certainly an idea that is only going to grow in its acceptance, I think, in the community, and certainly it's something that's long overdue. Join us next time when our guest will be Joe Dales from the RH Accelerator, a private equity firm dedicated to supporting new and emerging businesses. That's next time on The Back 40. We've been talking today with Dr. Cate Dewey and Dr. Jeff Wichtel of the University of Guelph Veterinary College. Thank you both for joining us today.
Thank you. It's been a pleasure.
You've been listening to The Back 40, brought to you by Trillium Mutual Insurance. Be sure to subscribe to The Back 40 wherever you find your favorite podcasts so that you don't miss an episode. The Back 40, bringing the ag community together one podcast at a time. I'm Mike Brine. Until next time, take care and stay safe.